Hello all. So today we are talking about resistance training programs. This is chapter 14, part 1. So resistance training, also known as strength training or weight training, is a standard part of a comprehensive personal training program. A resistance training program can affect almost every system in the body and is used in a wide variety of populations. The benefits of resistance training are numerous and include increases in strength, muscle mass, and bone density. Almost every population can benefit from resistance training, from children preparing for youth sports to individuals trying to counteract the effects of the aging process. So the objectives for fitness professionals should be to define resistance training principles, review and how and why resistance training should be performed, design, evaluate, and implement resistance training programs, and evaluate clients' resistance training needs and progress. The terms resistance exercise and resistance training are often used interchangeably. However, there is an important distinction between the two terms. Resistance exercise refers to a single exercise session, whereas resistance training refers to a combination of many consecutive resistance exercise sessions over time. Thus, a resistance exercise protocol is an exercise prescription for a single session, most commonly called a workout. And a resistance training program is an overall plan guiding the specific exercise parameters chosen for each exercise protocol. Designing a resistance training program is a very individualized process, and the needs and goals of the client are paramount to the selection of program characteristics. However, be aware that although a client may be training to maximize muscle hypertrophy, the client will also develop some muscular strength and endurance. Thus, the program will be at the same time both specific and general. The general principles of any effective resistance training program are as follows. Specificity of training. Only the muscles that are trained will adapt and change in response to a given program. For this reason, resistance programs must target all muscles for which a training effect is desired. Specific adaptations to impose demand, or the SAID principle. SAID indicates that the adaptation will be specific to the demands that the exercise places on the individual. For example, if a high number of reps are used, the muscles will increase their ability to perform a high number of repetitions, or muscular endurance. Progressive overload. As the body adapts to a given stimulus, an increase in the stimulus is required for further adaptations and improvements. Thus, if the load or volume is not increased over time, progress will be limited. Variation in training. No one program should be used without changing the exercise stimulus over time. An example of increasing variety in training is periodized training. So periodization is the basic manipulation of the training variables of volume, intensity, frequency, and rest intervals as a means of optimizing desired physiological outcomes while concurrently reducing the incidence of overtraining. Periodization allows for optimal training and recovery in a resistance training program. Prioritization of training. It is difficult to train for all aspects of muscular fitness. Thus, within a periodized training program, one needs to focus or prioritize the training goals for each training cycle. This technique is often used in athletics, paralleling competitive season schedules. The key to a great program design is to identify the specific variables that need to be controlled to best predict and/or ensure the desired training outcomes. The most challenging aspect of resistance training exercise prescription is deciding which changes in program design will best meet an individual's training goals. Appropriate changes in the resistance training program are required over time. This means that sound decisions must take into consideration the needs of the sport or activity, the individual training response, and available testing data. Therefore, the resistance training exercise prescription is a continual process of planning, assessing, and changing. Planning a resistance training exercise prescription allows one to quantify the exercise stimulus. Planning ranges from the initial development of a single exercise session to the variation of the training program over time. A successful personal trainer needs the ability to quantify a client's workout and evaluate progress. made to ensure the program is safe and effective and will lead to optimal physical development of the client. The gains made in any variable related to muscular performance will ultimately be linked to an individual's genetic potential. A deconditioned individual will likely achieve large initial gains because of the great adaptive potential available. As training proceeds, the rate of adaptation slows. As an individual approaches genetic limits over time, the physiological adaptation as measured from baseline will continue to increase, albeit at a much slower rate. At this point in the training process, because gains are less noticeable, other goals for the resistance training program must be targeted to prevent the client from losing interest because of a lack of progress. Appreciation of the process by which adaptation occurs over time is critical in developing an optimal program. When working with a new client, personal trainers should always devote adequate time to evaluate the client's prior resistance exercise experience and discuss their training goals carefully before beginning an exercise session. The initial assessment should include the following: a needs analysis focusing on learning about the client's personal goals and needs, the intended time frame for achieving these goals, targeted areas or muscle groups, health issues such as cardiovascular disease, asthma, diabetes, osteoporosis, osteoarthritis, immune system disorders, and neurological disorders, musculoskeletal limitations, and recent injuries or chronic injuries, as well as sites of pain, and so on. Personal trainers should try to understand the motivation underlying their clients' goals. In addition, personal trainers should assess the level of support their clients feel they have available from family or friends. And finally, personal trainers should discuss any prior resistance training experience their clients have had in order to uncover potential challenges or barriers to training and develop appropriate strategies for motivation. Personal trainers work with clients to develop strategies to overcome potential barriers to resistance training. These initial assessments will help personal trainers determine which muscle groups, energy systems, and muscle actions need to be trained, and how these and other acute program variables will be manipulated to meet the specific needs of the training program. Before developing a resistance training program, personal trainers should take the time to conduct a baseline fitness assessment consisting of anthropometric measurements of height, weight, circumferences, skin folds, etc., resting hemodynamics, heart rate, blood pressure, body composition, and tests of muscular strength and endurance. Determination of the initial fitness is necessary to the development of an effective training program. Muscular strength assessments include the 1 repetition maximum or 1RM testing on a variety of exercises, especially those exercises that involve the major muscle groups such as bench press and squat, but only if tolerable by the client. The 1RM test allows the personal trainer to determine loading values for a particular exercise. There are specific procedures that should be followed when conducting a 1RM test to help ensure safety, reliability, and validity of the test. Although 1RM is a measure of maximal strength, muscular power can be tested by using the medicine ball put for the upper body power assessment and the vertical jump test, or standing long jump for the lower body muscular power assessment. Muscular endurance testing must include curl-ups, push-ups, or maximal amount of repetitions that can be performed at a given percentage of the 1RM load. It is exciting and motivating for clients to see improvements toward reaching their goals. To see these improvements, it is important that personal trainers keep records of their clients' progress. Individualized training logs are a useful tool for monitoring progress. These logs should record specific exercises, resistance or load, number of sets, and number of repetitions. Considering discussing using a rating of perceived exertion or RPE scale, or a 0 to 10 scale rating effort as well. The training log provides a record of the resistance and knowledge of performance of previous exercise sessions, which is necessary for assigning the appropriate resistance for successive sessions. Kept over time, these logs provide the personal trainer with a means to examine and evaluate program effectiveness or to identify areas of weakness. Formal reassessment of a client's progress should occur periodically for encouragement, but not so often that there has not been enough adequate time for noticeable changes to develop. These follow-up assessments should include the same measures as administered at the baseline assessment, including anthropometrics and tests of muscular strength, power, and endurance. Based on these assessments, the concepts of progression, variation, and overload can be applied to the resistance training program to achieve optimal physiological adaptations and to accommodate changing fitness levels and goals of clients. These assessments give fitness professionals a basis for modifying the short-term acute program variables, including choice of exercise, order of exercises, intensity, number of sets, the set structure, the rest periods, the load or resistance, and repetition speed. Variation can be incorporated by altering joint angles and positioning. Primary exercises versus assistance exercises, or multi-joint exercises versus single joint exercises to stress the muscles and joint specified by the client's need analysis. Progressive overload can be accomplished by increasing the intensity and or volume, by increasing the resistance or the number of sets or number of reps or the number of exercises, or even by decreasing or increasing the rest intervals. Clients are not replicas of each other. Similar training programs provided to different clients will result in varied training responses. Therefore, skilled and effective personal trainers do not give standard programs to multiple clients. Exercises need to be modified to best suit the anatomical characteristics, needs, and abilities of each client. Additionally, the personal trainer must make modifications in the progression of the program based on the training response of the specific client. Adjustments to programs should focus on optimizing the individual's physiological adaptations. To design an effective resistance training program, the personal trainer needs to pay attention to feedback from the client. Clients may request favorite exercises or muscle groups, or they may complain of pain or fatigue requiring program modifications. Personal trainer must be alert to this feedback and exchange further feedback to ensure that the program and strategy meet the expectations of the client. This can be accomplished by asking the client for feedback. For example, how do you think the workout went? Did you feel that you worked out hard enough, too hard, or just right? What did you find went especially well or easier? And what was particularly challenging? Always pay attention to physical signs of overuse or exhaustion, such as dizziness, lightheadedness, complexion changes, profuse sweating, and facial expressions and muscular exhaustion. Clearly, working a client to the point of vomiting or passing out is not safe and will not leave a good impression with clients or any spectators who are present when medical attention arrives. Of special concern for fitness professionals is the careful and proper progression in the resistance training program, especially for beginners or those coming back from an injury layoff. Too much exercise, too heavy of exercise, and or accentuated eccentric exercise can lead to an excessive amount of muscle tissue damage and breakdown. This can result in delayed onset muscle soreness, or DOMS, or in extreme cases, rhabdomyolysis. Rhabdomyolysis is a clinical pathology that is characterized by the rapid breakdown of muscle tissue, resulting in high amounts of intramuscular proteins, myoglobin, myosin, and myosin protein, entering into the bloodstream that are potentially harmful to kidneys and can cause kidney failure and sometimes death. Oftentimes what you'll see is that their urine will look like Coca-Cola or that color. Basically, that's just blood that's in the system, and again, can cause some serious problems. The most common manifestation of muscle injury is called DOMS. DOMS symptoms, delayed onset muscle soreness, are a first sign that the individual has done too much too soon. DOMS is a condition of heightened post-exercise soreness that presents in the initial 24 to 48 hours after the exercise session and may last upwards of 5 to 7 days. Although some swelling, pain, and soreness are common and classical signs of muscle tissue adaptation following a workout, DOMS should not be considered a goal of the training program, such as no pain, no gain. If these symptoms are extreme, tissue damage may be more serious, and DOMS is likely to reduce training potential as well as having a deleterious effect on performance. Pay attention to the client's hydration levels and medications to help minimize potential muscle damage from a workout. Dehydration can cause muscle damage, limit one's force production, and decrease the training potential of the workout. Monitor water intake and provide scheduled fluid consumption throughout the workout. Be aware that medications such as statins or diuretics could also influence muscle tissue damage. For example, rhabdomyolysis may develop from disease, infections, metabolic disorders, or even statins used for the control of cholesterol levels, which are unrelated to resistance training. Symptoms of rhabdomyolysis include severe muscle aches, weakness, and extremely dark reddish-brown urine. Kidney shock and acute renal failure can develop in up to 2 days after major tissue trauma. If rhabdo is suspected, seek medical help immediately. Fitness professionals should always explain the muscle groups that the exercise is intended to target. And clients should be taught how to differentiate between muscle fatigue and soreness and extreme soreness, pain, or injury. Clients must be told that new exercises often feel uncomfortable or awkward, but that if pain is felt in any joint or synergistic or stabilizer muscle, that exercise should be discontinued. The exercises should be stopped immediately if the client complains of pain or the fitness professional suspects the client is in pain. The last thing a fitness professional wants is to induce or aggravate an injury. Feedback from the client can also come from paying close attention to the technique of the client during an exercise. Deterioration in technique often results from fatigue or insufficient flexibility in the range of motion or ROM involved in the exercise. Proper technique should always be a priority. When technique is compromised during an exercise, the exercise should be either stopped or modified to re-establish correct technique to avoid injury. In summary, it is important to properly assess workouts and prevent extreme muscle injury from occurring. The resistance load and volume training of training need to be carefully progressed and monitored to limit muscle tissue damage and develop a physiological toleration to heavier resistance and volumes of exercise stress. Emphasizing proper technique and paying attention to the basic principle of progression are important to an effective and safe exercise prescription. To avoid overshooting a client's tolerance, personal trainers carefully progress the client to heavier loads with prudent volume changes, thus allowing for adequate recovery from each workout. A simple Likert type scale, much like what you see here, can be used to gauge the level of soreness for the client. Individuals having a score of 3 or more should have the resistance intensity or volume reduced dramatically and should increase the amount of rest allowed in a periodized training program. Although muscle soreness is a normal result of muscular adaptation, extreme soreness is a sign of physiological overshoot. Optimal program design needs to be individualized for each client's goals. Personal trainers encounter an assortment of clients with a plethora of goals, including weight loss, weight gain, building strength, building muscle, shaping and toning, overall improving health, improving speed, agility, power, balance, and coordination, decreasing blood pressure or cholesterol level, and managing diabetes and other chronic diseases, injury rehabilitation, or even sport-specific training. Often the desired goals of clients are unrealistic. When improvements do not meet expectations, motivation can be lost. Frustration may set in and non-adherence to the program can occur. Therefore, it is crucial that the personal trainer help the client understand what realistic and obtainable goals are. Considering the time course, the individual's training history and status, the fitness level, and genetic potential. The expectations of the client must be realistic and measurable, as we've talked about before, considering the physiological time course of neural and cellular adaptations, goal setting and time frame, as well as the individual's age, physical maturity, their training history, and psychological and physical tolerance should also be considered. Progression toward the goals must be gradual to minimize the risk of injury. Common program goals in resistance training are related to improvements in function, such as increased muscular strength, power, and local muscular endurance, or decreased body fat. Other functional gains, such as increased coordination, agility, balance, and speed, are common goals of a program. Factors such as balance may have implications for injury prevention by limiting falls in older individuals. Other goals may relate to physiological changes related to increased body mass through muscle hypertrophy, improved blood pressure, decreased body fat, and increased metabolic rate for caloric expenditure. So in setting goals and evaluating progress in a resistance training program, it's vital. Setting goals and evaluating progress in a resistance training program are vital to realistic progress and gains. For the most part, training goals or objectives should be measurable variables, such as the 1RM strength or vertical jump height and fat mass loss, so that one can objectively judge whether or not gains were made or goals were achieved. Examination and evaluation of a workout log is invaluable in assessing the effects of various resistance training programs. Formal strength tests to determine functional changes in strength can be done on a variety of equipment, including isokinetic dynamometers, free weights, and machines. Using the results of these objective tests can help in modifying the exercise program to reach previous training goals and or to develop new goals. Athletic performance and good health are not always the same thing. A person being a competitive athlete does not mean that he or she makes healthy choices or has a healthy lifestyle. Many elite athletes train in ways that far exceed what is recommended for good health, such as lifting 7 days a week or running 140 miles in a week or training 4 to 6 hours per day. In fact, they may actually do exercises that would be considered contraindicated for the average healthy individual. Thus, goals in resistance training have to be put in the context of the desired outcomes of each individual, but also within what is healthy. A concept called capping may need to be applied to various training situations in which small gains require very large amounts of time to achieve, and yet in the long run, these small gains are not necessary for success. Capping a training goal is a tough decision that comes only after an adequate period of training time and observation of what the realistic potential for further change is for a particular variable. This may be related to performance goals, such as bench press 1RM strength, or some form of physical development, such as calf size. At some point, one must make a value judgment on how to best spend training time. By not adding any further training time to develop a particular muscle characteristic, such as strength, size, and power, one decides that the current gains are good enough and it is time to go into a maintenance training program. Thus, more training time is available to address other training goals. Ultimately, this decision may result in greater total development of the individuals. Decisions such as capping are part of the many types of clinical decisions that must be made when monitoring the progress of resistance training programs. Are the training goals realistic in relation to the sport or health training goal, vital to the program's success? These difficult questions need to be continually asked in the goal development phase of each training cycle for any program. Too often, goals are open-ended and unrealistic. Careful attention must be made to the magnitude of the performance goal and the amount of training time needed to achieve it. Although scientific studies may last up to 6 months, most real-life training programs are developed as a part of a lifestyle for an individual's sports, career, or whole life. Over time, clients' goals change, and thus resistance training programs must also change to reflect these changing needs. Goals might at times exceed the reality of genetic limitations. For example, some men desire near impossible and extreme muscle size, such as 23-inch biceps and 36-inch thighs, 20-inch necks and 50-inch chests, or strength, 400-pound bench press. Or in contrast, some women desire drastic decreases in body weight and limb size and or shape. Genetic limits and anatomical structure or somatotype may make these changes unattainable. Ultimately, for both men and women, goals must be carefully and honestly examined to determine if the resistance training program can actually stimulate the changes desired. Many different training tools, free weights, machines, and medicine balls can be used in resistance training programs. Each tool fits into a category of training which has certain inherent strengths and limitations. The modality chosen should depend on the accessibility of equipment, the needs and goals and experiences and limitations of the client as well. Variable resistance equipment operates through a lever arm or pulley arrangement. Its purpose is to alter the resistance throughout the exercise's range of motion in an attempt to match the increases and decreases in strength, or the strength curve. Proponents of variable resistance machines believe that by increasing and decreasing the resistance to match the exercise's strength curve, the muscle is forced to contract maximally throughout the range of motion, resulting in maximal gains in strength. There are three major types of strength curves. Ascending, you'll see here with the yellow line. Descending, which is the purple line or magenta line, and the bell curve, which is the purple line. In an exercise with an ascending strength curve, it is possible to lift more weight if only the top half or quarter of a repetition is performed, rather than if the complete range of motion of a repetition is performed. For example, an exercise with an ascending strength curve is a squat exercise. If an exercise has a descending strength curve, it is possible to lift more weight if only the bottom half of the repetition is performed. Such an exercise is upright rowing. A bell-shaped curve is an exercise in which it is possible to lift more resistance if only the middle portion of the range of motion is performed, and not the beginning or ending portions of the range of the motion. Elbow flexion has a bell-shaped strength curve because there are three major types of strength curves. Variable resistance machines have to be able to vary the resistance in three major patterns to match the strength curves of all exercises. To date, this has not been accomplished. Additionally, because of variations in limb length, point of attachment of a muscle is tended to the bones, and body size, it is hard to conceive of one mechanical arrangement that would match the strength curve of all individuals for a particular exercise. Biomechanical research indicates that certain types of cam-operated variable resistance equipment do not match the strength curves of specific exercises such as the elbow curl, the fly, the knee extension, the knee flexion, and pullover exercises. In women, one type of cam equipment was shown to match the strength curves of females very well, although not for all aspects of each exercise. For example, in women, the cam resulted in too much resistance near the end of the knee extension exercise and provided too much resistance during the first half and too little during the second half of elbow flexion and extension. The knee flexion machine matched the female's strength curve well throughout the range of motion. This research indicates that not all machines are appropriate for all populations or for all exercises. Elastic resistance bands have become popular within the fitness world because they are relatively easy to work with and less intimidating to clients, although very effective as a training modality if the resistance can be heavy enough. Care must be taken when using elastic bands with certain types of exercises that do not match the ascending strength curve. A possible drawback to elastic bands is that the constantly increasing resistance offered as the band is stretched In other words, elastic bands have a resistance pattern that only matches in an ascending strength curve. At the beginning of a muscle flexion, the resistance is low, and at the end of the flexion, the resistance is very high. If the setup is not correct, only part of the muscle involved in the latter part of the flexion may be optimally stimulated. Thus, proper starting angle, band fit, and stretch are essential for optimal training outcome. Also, isotonic is traditionally defined as a muscular contraction in which the muscle exerts a constant tension. The execution of free weight exercises and exercises on various weight training machines, although usually considered isotonic, is not by nature isotonic. The force exerted by a muscle in the performance of such exercises is not constant, but varies with the mechanical advantage of the joint involved in the movement and the length of the muscle at a particular point in the movement. A more workable definition of isotonic is a resistance training exercise in which the external resistance or weight, dumbbell, does not change in both a lifting or a concentric phase and a lowering phase or an eccentric phase, a lengthening, occur during each repetition. Thus, free weight exercises and exercise machines that do not vary the resistance are isotonic in nature. Because there is confusion concerning the term isotonic, the term dynamic constant external resistance training has been adopted. The types of devices used for dynamic constant external resistance include dumbbells, barbells, kettlebells, weight machines, and medicine balls. These are generally devices that do not use levers or pulleys. The major advantage to this type of device is that it does not stimulate the neuromuscular systems involved maximally throughout the entire range of motion. The changes in the musculoskeletal leverage occurring during a movement also changes the force requirement and thus the exercise stimulus. However, these types of devices require recruitment of muscles other than the primary movers of an exercise to act as stabilizers. This increases the total amount of physiological work the body must do to perform the exercise, as well as providing exercise stimuli to the stabilizing muscles that are very important in a real-world setting or for athletic performance. These types of modalities are referred to as free-form exercises, as they operate in multiple dimensions of space, the frontal, sagittal, and transversal planes. Other benefits to most constant external resistance devices include little or no limitations and the range of motion allowed, and easy adaptation of the exercise to accommodate individual differences such as the client's body size or physical capabilities. Equipment fit is also not a limiting factor for large and small body sizes and limb lengths. Specialized static or isometric contraction devices in which a person pulls or pushes against an immovable resistance are rarely used. Pushing an overloaded barbell against the safety racks or using a wall or partner for isometric contraction is occasionally used for an individual to overcome a sticking point, and this form of resistance is called functional isometrics. Isometrics or static resistance training refers to a muscular action in which no change in the length of the muscle takes place. This type of resistance training is normally performed against an immovable object such as a wall, a barbell, or a weight machine loaded beyond the maximal concentric strength of an individual. Isometrics can also be performed by having a weak muscle group contract against a strong muscle group, such as trying to bend the left elbow by contracting the left elbow flexors maximally while resisting the movement by pushing down on the left hand with the right hand with just enough force to prevent any movement at the left elbow. If the left elbow flexors are weaker than the right elbow extensors, the left elbow flexors would be performing an isometric contraction at 100% of a maximal voluntary contraction. Isometric contraction leads to static strength gains, but the gains are substantially less than 5% per week. Increases in strength resulting from isometric training are related to the number of muscle actions performed, the duration of the muscle actions, whether the muscle action is maximal or submaximal, the angle at which the exercise is performed, and the frequency of training. Most studies involve isometric training manipulate several of these factors simultaneously. It is difficult, therefore, to evaluate the importance of any one factor. Enough research has been concluded, however, to allow some recommendations concerning isometric training. Isometric exercises are thought to strengthen muscle fibers within 15 degrees of the position being held isometrically, and therefore clients should perform multiple positions with isometric contraction to ensure full range of motion strengthening. Also, isometric contraction is good for individuals with joint disorders in which pain is elicited by motion, such as rheumatoid arthritis. Isokinetic devices allow one to maintain a maximum resistance throughout the whole range of motion by controlling the speed of the movement. These devices use friction, compressed air, or pneumatics, which often allow for both the concentric and the eccentric component of a repetition, or hydraulics for the concentric component of a repetition. Isokinetic exercises, although popular in the rehabilitation setting, have never caught on as a typical modality used in a weight room. The initial excitement for this training modality was related to the ability to train at fast velocities similar to the high-speed movement seen in sport and real life. Isokinetic refers to a muscle action performed at a constant angular limb velocity. Unlike other types of resistance training, there is no set resistance to meet. Rather, the velocity of movement is controlled. The resistance offered by the isokinetic machine cannot be accelerated. Any force applied against the equipment results in an equal reaction force. The reaction force mirrors the force applied to the equipment by the user throughout the range of motion of an exercise, making it theoretically possible for the muscles to exert a continual maximal force throughout the movement's full range of motion. Pneumatic resistance or compressed air exercise has been relatively popular as it allows both the concentric and eccentric portions of a repetition and can be adjusted during a repetition or a set of exercises with handheld buttons. This type of device has been popular for working with older populations. In addition, with no deceleration, it can be used effectively to train power with joint exercises not possible with conventional machines. Power is as important for older adults to maintain function as it is for athletes' performance. Because of the fixed nature of the configuration for most pneumatic machines, they are unable to address key factors such as balance and control in a multidimensional environment. Hydraulics equipment has also become more popular with many fitness clubs, promoting it as a safe and non-intimidating form of resistance exercise, although this modality has no deceleration in its repetition range and has been used as a type of power training modality. It also has no eccentric component, which limits its efficiency as twice the number of repetitions may be required to get the same effect as a typical concentric-eccentric repetition. Training the eccentric phase is important to protect the body from injury and also to enhance the ability to recover from injury. Furthermore, concentric-only training appears to be less resistance to detraining. A topic of great debate, especially in the health and fitness world, is the use of free weights versus machine resistance exercises. These different exercise modalities were discussed previously in the sections on constant external resistance and variable resistance devices. The following is a comparison of the two modalities. Machines are not always designed to fit the proportions of all individuals. Clients who are obese, who have special considerations or disabilities, and who are shorter, taller, or wider than the norm may not be able to fit comfortably in the machines. In contrast, free weight exercises can easily be adapted to fit most clients' physical size or special requirements. Machines use a fixed range of motion, thus the individual must conform to the movement limitations of the machine. Often these movements do not mimic functional or athletic movements. Free weights allow full range of motion, and the transfer to the real world movements is greater than that for machines. Most machines isolate a muscle or muscle group, thus negating the need for other muscles to act as an assistant mover or stabilizer. Free weight exercises almost always involve assisting and stabilizing muscles. On the other hand, if the goal is to isolate a specific muscle or muscle group, as in some rehabilitation settings or because of physical disabilities, machine exercises may be preferred. Although it is never advisable to perform resistance exercise alone, machines do allow greater independence as the need for a spotter or helper is usually diminished once the client has learned the technique of the exercise. However, there is a misconception of exercise safety that may lead to a lack of attention being paid to the exercise. Injuries are still possible when using machines, specifically when there's a breakdown in lifting form or improper seat height, lifting form, and or joint alignment. Machine exercises may be more useful than free weight exercises in some special populations. One reason for this is that machines are often perceived to be less intimidating to a beginner. As the resistance training skill and experience level increases, free weight exercises can be gradually introduced if desired. However, it is important to inform clients of the benefits that free weights have compared with machines, such as increased musculoskeletal loading that reduces the risk of developing osteoporosis and improved balance. Certain free weight exercises, such as Olympic-style lifts and hydraulic and pneumatic machines, allow training of power as no joint deceleration occurs. And rotational resistance accommodates certain body movements, such as shoulder abduction, that would be difficult to work through a full range of motion with free weights. From the comparison earlier, it seems that variable resistive devices or machines in general are at a comparative disadvantage to constant resistance devices such as free weights. However, machine exercises are still recommended for certain populations and can be very useful when used appropriately. In fact, a safe and optimal effective resistance training program involves a combination of both free weight and machine exercises, taking into consideration many aspects of the client's needs and the advantages of the different modalities. Both modalities can be used to add variation to the training program and are effective tools in a personal trainer's toolbox. To summarize, for the general population, a combination of free weights, variable resistance machines are generally most effective. Machines and other variable resistance devices are recommended as an adjunct to a free weight training program in mid-level and advanced clients. From the comparison earlier, it seems that, I feel like this is repetitive. And that is all we have for today. We'll pick this back up. We'll talk about part 2 in our next session. Have a great day.